Hello everyone and welcome back. In today's teaching, we're going to be talking about the blood circulation through the heart, and the heart is the muscular pump that pumps blood throughout the body. Now, essentially, the heart has four chambers. It has two upper chambers and two lower chambers. But let's talk about these labelings so that you can see them clearly. So here we have the right atrium. Here we have the left atrium. Here we have the right ventricle. Here we have the left ventricle. Here we have the inferior vena cava. Here we have the superior vena cava. Here we have the tricuspid valve. Here we have the pulmonary trunk. Here is the aorta. Here is the left pulmonary artery. This is the right pulmonary artery. Here is the left lung. And here is the bicuspid valve. So just like I said earlier, the heart has four chambers. That's an upper chamber and a lower chamber. Now, these upper chambers, they are called atrium, while the lower chambers are called what? Ventricles. So let's start by discussing how blood is being circulated throughout the body using this muscular pump called the heart. So we have what we call oxygenated blood and we have what we call deoxygenated blood. Now, the oxygenated blood contains oxygen, while in deoxygenated blood, the oxygen content has been used up. So that means the body has to find a way to refill oxygen to now send throughout the body. So deoxygenated blood from the lower body comes through the inferior vena cava, and the one from the upper part of the body comes through the superior vena cava and drains into the right atrium. So here is the right atrium. Blood from the inferior vena cava and the superior vena cava drains to the right atrium, passes through the tricuspid valve. Now, valve, the structures that prevents backflow of blood. So the blood from inferior vena cava and the superior vena cava drains into the right atrium, passes through the tricuspid valve, and drains straight into the right ventricle. So the one from inferior vena cava, superior vena cava drains to the right atrium, from right atrium to the right ventricle, and from this right ventricle, it goes to the pulmonary trunk through the pulmonary valve. That means there's a valve also between the right ventricle and the pulmonary trunk, and that valve is called the pulmonary valve. So from the right atrium through the tricuspid valve to the right ventricle, from the right ventricle to the pulmonary trunk through the pulmonary valve. Then from this pulmonary trunk, it now passes through the right pulmonary artery and the left pulmonary artery to the lungs for gaseous exchange. So from the inferior, superior to the right, through the tricuspid to the right ventricle, through the pulmonary valve to the pulmonary trunk, then through the pulmonary arteries, that's the right and the left, the deoxygenated blood is being passed to the lungs. Now, if you recall, we know that all arteries, they carry oxygenated blood except for pulmonary artery. So here is the right pulmonary artery and the left pulmonary artery carrying the deoxygenated blood to the lungs. So that is the one for this side. So that means that the right heart to the lungs is called pulmonary circulation. So let's go to these other aspects. So after the blood has been oxygenated, it gets returned to the left atrium through the pulmonary vein. So, and here is the pulmonary vein. Here's the pulmonary vein. And if you recall also, we said that all veins carry deoxygenated blood except for pulmonary vein. So here is the pulmonary vein returning oxygenated blood to the left atrium. So from this left atrium, it moves to the left ventricle through what we call the mitral valve or the bicuspid valve. So from the pulmonary vein to the left atrium, from the left atrium to the mitral or bicuspid valve, through the mitral valve or bicuspid valve to the left ventricle. Now, from the left ventricle, there's also a valve between the left ventricle and the aorta called the aortic valve. So from this left ventricle, it goes to the aorta, also passing through the aortic valve here that prevents backflow. So it goes to the aorta, then from the aorta to the body tissue. So that means from the left heart to the body is called the systemic circulation, while from the right heart to the lungs is called pulmonary circulation. So once again, deoxygenated blood from the body, upper and lower, goes to the right atrium. From right atrium, tricuspid valve to the left ventricle. From here, it goes through the pulmonary valve to the pulmonary trunk to the right and left pulmonary artery to the lungs for oxygenation, for gaseous exchange. Then from here, it gets returned through the pulmonary vein to the left atrium, from left atrium to the left ventricle, passing through the bicuspid valve. Then from left ventricle through the aortic valve, passes through the aorta, then to the systemic circulation. So please, if you have any question, do well to drop them in the comment section, and don't forget to like and subscribe. Thank you so much.